Hey Karen, this is Kay.
Yes, ma'am.
Are you doing slides today or should we do our own?
Do your end, please. It just is always so slow on my end.
No problem. Thank you.
Yep. Yep. Do I have any other speakers on the call that need to practice sharing real quick before we get started?
I wouldn't mind sharing my screen just to make sure it looks right.
Thank you. That'd be appreciated.
This is Kay. I can go after, I think that was David, wasn't it? Yep.
Yeah.
That was Tom.
Oh, sorry.
Tom Thompson. Yeah.
All right. Looks good, Tom. All right. Kay, you want to go ahead and do yours?
How about it?
Just thinking about it. There it goes. I see it.
And then I'll flip over to the document. Can you see that now?
Yeah, I see it.
All righty.
Thank you. And we did K's earlier, so I think we're set. Did I say K?
Hey, Karen, it's only Monday.
Thanks. I need the excuse. You all know what I meant. Good afternoon, Commissioner.
Good afternoon. All right, good afternoon, everyone. Welcome to the Education Continuation Task Force. Thanks for joining us today. Just as a reminder, using the Microsoft Teams function, you can see the attendees over on the right side. If you click on the participant icon and show the chat feature there, and we use chat for questions and comments, and we do record the chat. It goes in part of the meeting minutes, and also we are recording the task force today, as we do every week. We have a full agenda today. I think the Lieutenant Governor was able to join us. Lieutenant Governor, do you have any opening comments?
Hello, everybody. I just wanted to join today to stay up to date on the conversation and hear folks' comments and questions, and so that I can be able to take those back to the governor and continue to figure out different ways we can support schools and students and families. So I look forward to the conversation. Thank you.
Thank you, Lieutenant Governor, for being with us. I know your schedule is very hectic. Appreciate you being on these calls and all your assistance also in the throughout this entire pandemic. You have always just been a text and a phone call away from me, so I want to thank you for that. Also, a reminder, if you're having trouble with your band or with seeing or hearing, you may want to try turning off your camera to receiving the pictures to help save bandwidth. That's a strategy. We've been having some trouble the last few days due to internet issues, I think, around the state due to heavy usage. And I will also have to be leaving the meeting today around 2. Karen Dodd will continue facilitating. I had to cancel a dental appointment several days ago due to another one of these meetings. My dentist basically threatens that I need to take advantage of this one appointment that he had this afternoon at 2. So I will, or 2:15. So I will be headed to the dentist. You're in good hands with Karen Dodd, and assuming the Lieutenant Governor can stay with us as well. So we will get to our first topic. It's on regarding Medicaid expanded care. We have various presenters today due to the nature of that topic. Robin Kinney, Lisa Lee, and Lee Geis. Turn it over to you, Robin.
Good afternoon. Thank you, Commissioner Brown. And I'm going to actually kick us off. We wanted to spend a few minutes talking to you about something that is not, it's not directly coronavirus pandemic related, but it sure will help us during this time. It's something that we've been working on for almost a year with the Department for Medicaid from the Cabinet for Health and Family Services. They've been wonderful partners and continue to be. So I'm going to actually ask that my staff, and that is Stephanie O'Connor and Lindsay Kimbleton, join our call today. And they're going to walk through a high-level overview of Medicaid expanded care. This was formerly known as free care. And so it's not brand new. There's been a little bit of confusion about that. But expanded care is more appropriate title for this very worthwhile program. If I could have Stephanie actually pull up the presentation, and we'll ask them to present today. And then at the end, we'll allow for some questions. We do have with us on the webcast today, Commissioner Lisa Lee, who is the Commissioner of Medicaid, and Lee Geis, also from Medicaid. But we show our first slide really with both of our logos because it's an important program for both of us, both of our agencies, as we continue to support local school districts. So I'm going to turn it over to Stephanie and Lindsay. And after the presentation, we'll allow time for some questions.
All right. Okay, so Medicaid program. First, let's talk about the 3 programs that make up our Medicaid school-based program. The school-based health service program is the easiest to understand. Basically, if a Medicaid eligible child receives a service such as OT, PT, speech, or mental health, then the school may be able to submit the claim for Medicaid reimbursement. The school should be receiving small increments of monies throughout the year from this program. The school-based administrative claiming program, also known as the SBAC program, is the next program to receive the most reimbursement. And lastly is the cost report cost settlement. The school-based administrative claiming program, more commonly known as SBAC, operates using a time study methodology. As one of our vendors always says, the SBAC program are the bookends. The direct services such as speech, OT, and PT are the books, and the time spent before and after the service is what makes up the SBAC program. This program allows schools to get reimbursement for administrative activities, such as Medicaid outreach, Medicaid service program planning, and policy development. Just remember, this program provides school districts with quarterly reimbursement. Lastly, the cost reporting cost settlement started with the 2008-2009 cost report. This annual process ensures that schools and the Department of Medicaid Services settle the cost. The cost reporting cost settlement is the final piece to the puzzle and ties everything together.
Medicaid reimbursement for the schools. One of the most common questions we are asked is, how much money will our district make? This is a very complicated answer and will take a couple of years for the schools to get the full picture. While our time today will be spent on the school-based health service program, which is also known as the direct service program or fee-for-service program, just remember that all three Medicaid school-based programs work together to give the schools reimbursement for their services. Please note, schools receive the most monies for the school-based health service program. If you participate in this program, you must participate in the other two programs. However, some schools choose to only participate in the school-based administrative claiming program. Also, most schools will receive a positive cost settlement. However, in some cases, schools can owe money back to DMS.
What is expanded care? On December 15, 2014, the Center for Medicare and Medicaid Services, also known as CMS, sent a letter to the states issuing guidance regarding free care. This program was originally called Free Care in Kentucky, but we are now referring to it as expanded care. The goal of this new guidance is to facilitate and improve access to quality health care services and improve the health of communities. This program expansion allows school districts to potentially bill for medically necessary services they provide that fall outside of the IEP.
What does this mean for Kentucky? On April 28, 2019, the Kentucky Department for Medicaid Services, otherwise known as DMS, submitted an updated state plan amendment to CMS to include expanded care in Kentucky. CMS approved the state plan amendment on November 4, 2019. This updated amendment allows schools to potentially bill for services that are provided to Medicaid eligible students and are medically necessary. However, these services must be available to all students, Medicaid eligible or not, at no cost to the student. The link that we have provided will show you the approved state plan amendment for Kentucky. In order to participate in the expanded care program, schools must include it on their KDE annual application and get the dual parental consent signed. Please see the chart below showing the students that have IEPs in the state, the number of students Medicaid eligible, and total number of students in the state.
Several requirements must be met before a school district may request reimbursement from Medicaid. First things first, the child must be Medicaid eligible. Just remember, kids go in and out of Medicaid eligibility all the time, and it's best practice to get assigned parental consent on all students. For the traditional IEP program, the service must be listed in the IEP. In this case, the IEP deems medical necessity. For expanded care, it must be considered medically necessary. Finally, make sure the practitioner is on the KDE SBHS annual application and is not being paid 100% federal funds. If a practitioner is paid 50% federal and 50% non-federal, only submit the non-federal portion on the cost data sheet to billing agents. Also, this program will not affect Medicaid services that are provided outside of the school setting. For example, Johnny can have speech therapy today at school, and he can also receive speech therapy at 5 p.m. tonight, as long as they both are medically necessary.
Covered services. This slide shows an overview of some of the services that will be covered by the expanded care program. Currently, speech services are the most utilized services in the school district. With expanded care, DMS has now expanded their practitioner list and will include providers such as marriage and family counselors, licensed professional art therapists, and several more. We hope that this will allow the school to get additional reimbursement for the mental health services they are already providing. For example, little Beckett's parents are going through a divorce and he needs help dealing with his emotions. He now goes and sees the counselor every week. This may be billable with expanded care. Also, expanded care will potentially allow schools a chance at getting additional monies for the services their school nurses currently provide. Also, the schools are able to bill for services provided via telehealth. Just remember that when providing telehealth services, each practitioner must abide by their licensure board's requirements. Lastly, contact tracing is not eligible for Medicaid reimbursement.
Be cautious of contractual agreements. Please remember that Medicaid reimbursement is only meant to cover a small percentage of the school's actual costs. We want to make sure that schools don't get in over their heads and are making financially sound decisions when it comes to this program. Once again, this program is not meant to recoup 100% of the practitioner's cost. Here's an example of what Medicaid reimbursement can look like for a school district. Olivia is paid 100% from general funds. Her district pays her $43.62 per hour, including salaries and benefits. Her Medicaid unit rate is $43.62 divided by 4, which is $10.88. The school district receives an average of $7.51 per 1 unit of reimbursable direct service therapy. The district received a total of $6,500 for Olivia for the entire year of direct service reimbursement. Medicaid's reimbursement of $6,500 only covers a small portion of Olivia's salary and benefits. Please remember, this example only includes reimbursement from the school-based health service program. Remember, you get reimbursement through all 3 programs, and these amounts cannot be predicted. And here's our contact information if you have any questions, and we will make this webinar or this slideshow available to you all.
So that concludes our presentation. We're happy to answer any questions that you may have. And of course, we have our partners from Medicaid on the call as well.
And don't forget, the guiding question for this item is, how can local school districts best utilize the opportunities of the Medicaid Expanded Care Program? We want to take your questions, also your feedback. You're on the advisory task force for a reason, because of your expertise and the groups and individuals you represent. So I believe Representative Bojanowski has a question.
Okay, yeah, I've got my microphone on. Okay, so what anticipated cost is there of administering that system? So for a large district like JCPS, are they going to have dedicated staff administering the Medicaid reimbursements? And do those costs, I had a conversation with, I believe, 7 counties, and their question was, why are we bringing it in-house as opposed to continuing to contract with outside agencies who are already billing Medicaid?
Okay, I can answer this. So usually the school districts, handle it by the director of special ed for the program. And right now, some schools have started getting the district health coordinator involved in implementing this program. We're not saying that other companies cannot include, contracted therapists. If they already bill, then that's fine. But the school has the opportunity now to be able to bill. Did that answer your question?
Yeah, I guess I'm just wondering, how will we absorb the costs? Because there's going to be cost to the time of someone doing that billing is just sort of the train of thought I was having.
Okay, so right now the schools actually, most schools except for a handful contract with a billing agent who provides a software. And so it's the therapist's responsibility to ideally to put in their own notes into the software, which they already have to record the services they provide, and this just translates into Medicaid reimbursement for the schools. So
thank you. That's very helpful.
You're welcome.
We have a question in the chat. Will mental health services provided by schools be covered under this as mandated by recent legislation? And can only Medicaid eligible students use the expanded care? And exactly which students are eligible? So a three-part question there. And for your assistance, those that are answering, that question is in the chat. Thank you, Donna, for that question. Those questions.
Hi, this is Mehek Kalra with Kentucky Youth Advocates, and I had a question around contact tracing and using that as a leverage with expanded care, I should say, knowing that CMS has given the opportunity to allow for contact tracing being a billable Medicaid service. Just wondering why that's already being said to not be a service that's provided by free care, knowing that reopening is going to be happening at schools in some level, and to ensure that we're protecting the employees within a school district.
Commissioner Lee or Lee guys, do you want to answer that?
Yeah, thank you.
Certainly. This is Lee guys. Can you hear me okay?
Yes, we can.
Okay. Mahak, let me say this. I was unaware that CMS has said contact tracing can be a Medicaid reimbursed service. And that's exactly the reason why the initial response was, no, it can't be covered under expanded care. We'll have to do a little bit more research on that. We were unaware that that was a possibility. Does that help?
Yes, it does, Lee. Thank you. And I'm happy to share any information that I have.
Well, I'll be looking forward to seeing your email.
Would you like me to, we still have another question in the chat. Would you like me to do that one?
Yes, Stephanie, if you'll go ahead and answer the three-part question from Donna House.
Okay, so the first one's, will mental health services once again be provided by schools be covered under this as mandated by recent legislation? We do hope that this program will allow schools to get reimbursement for these services. There's just a lot of factors that it involves, such as, you know, making sure the service is open to all students. Is the child Medicaid eligible? Do the parents sign a parental consent? But if all those factors are met, then we do hope and anticipate that the schools will receive reimbursement for some of those mental health services. And can only Medicaid eligible students use the expanded care? So you can only, this program only allows billing for Medicaid eligible students, but once again, under expanded care, the service has to be provided to all students, free, no charge to the students, and then you can only bill for Medicaid eligibles. And then exactly which students are eligible, you know, there's no way to predict which child is going to be Medicaid eligible for this program. We just ask, the best practice is for the schools to get a dual parental consent signed on all kids. And then if they happen to, you know, get Medicaid eligibility, their billing software will pick up on that and they will bill appropriately.
We are receiving a little bit of background noise. So if we could respectfully ask for, if you're not presenting or speaking, if you could put yourself on mute. Thank you. Kevin, unless we have other questions, that'll conclude our presentation for today. We will be sharing this tomorrow at the superintendent's webcast. The Office of Finance and Operations, KDE staff have done training for some of the contacts in our district's offices, but we're going to, since we do have some new superintendents that are joining us for the first time this school year, we're going to make this information available to them again tomorrow, so they'll be aware of this opportunity.
Thank you, Robin. I think there is a a clarifying question in the chat about that whether all students are eligible for expanded care services at schools.
So the only students that can receive reimbursement through the expanded care portion of this program are potentially just the Medicaid eligible students. I hope that answers the question.
Hi, this is Lisa Lee with Medicaid. If I could just one clarifying on that, as Stephanie said, yes, this is for Medicaid eligible children. Now, all children in the schools can receive those services, but this is an opportunity to allow schools to draw down additional federal dollars for children who are receiving medical services in schools. And the reason that it talks about free care, just for a little bit of history, that it'll maybe help solidify some of the information you've heard today. So previously, children in schools could only bill Medicaid for children who had services outlined in their IEP. And we have, for example, we know that there are buses or some maybe dental vans or vision vans that go to schools, and they would provide services to children in schools. And Medicaid had a rule that said you cannot bill Medicaid for those services provided to those children, those medical services, unless you provide them, bill every single person. That's where the free care came about. So what has happened now is Medicaid has changed their stance on that and said, we will allow you to bill Medicaid for services provided to children in schools, whether or not you bill other private insurance for those services. So this is a way to allow schools to draw down additional federal dollars for those services that they may be providing already to children, so they can get additional funds from the federal government. So that's why only Medicaid, they can only bill Medicaid children, but all children can receive those services. I hope that helps clarify.
And a little bit of a nuance out, and Eric Kennedy's pointing that out on the chat. So is there a difference between making it available as, Eric's comment says the given service must be made available to all students, but only those on Medicaid will be able to be paid for with those funds, as opposed to choosing to service other students not on Medicaid. Is that a difference?
So, this is from a Medicaid perspective. So if a school, let's say, for example, has a child psychologist, and every child has access to that psychologist, every child can see that psychologist, and the school currently, before the expanded care, just provided the services and received no benefit from Medicaid. Now, if that school identifies Medicaid eligible children based on CMS's clarification and new policy related to extended care, then that school can bill Medicaid for those children who see that psychologist. So every student has access to those services. But prior to, schools are just not set up to bill, for example, private insurance companies, but they are set up to bill Medicaid because of the IEP services. So they can continue to deliver services as they are today, identify Medicaid eligible children and bill Medicaid for those services, and then draw down that federal match so that it doesn't cost as much to provide services to that Medicaid eligible child.
Thank you. I think that clarifies. And Eric, you also followed up with similar comments about how this is not going to be a massive flow of funds and it won't fully provide for those health services, but will be a much needed source of additional funding for those Medicaid eligible students receiving the service. And then we have a question here from Mr. Peevler. For students who are deaf or hard of hearing receiving a covered service, would interpreters used during the service also be a coverable expense?
So for interpreters, it is allowed with the traditional IEP program, but you can only bill for the interpreter when the child is receiving another covered service that's listed in the IEP. So for example, you can only bill for Johnny, who has an interpreter during his PT session. You cannot bill for all day interpreter services.
And this is Lisa again. I think too, what's important to remember is this is a brand new, it's outside of the IEP. These are brand new services. So I think at the beginning of the webinar, it was stated that it's going to take a couple of years to get the full picture. And I think that that's what's going to happen here as schools move forward, they'll know what services are needed in their schools and what's lacking. And I think the other big thing to kind of keep in mind is even though it's a small, it may be small dollars for some of those direct services for the providers. Beginning July 1st, the expanded care is also going to be subject to administrative claiming. So for example, you'll be able to, there'll be a random moment time study, and that time study will look at the amount of administrative work being put into some of these services. So the schools will be able to garner increased administrative claiming funds for those services as well.
Okay, great, thank you. And then another follow-up question. If an outside contractor comes to provide services, who bills Medicaid, the contractor or the district?
I think that would be between the contractor and the school. Both cannot bill. So if you have a contract with someone, if a school does, they can go ahead and continue those contracts as they are now. You may look at what services that the schools need on a more frequent basis, for example, and kind of maybe get those in-house if you wanted to. But you can continue with any contractual obligations you have. And if a contractor currently comes in, provides services, and bills Medicaid, the schools can continue with that arrangement if they choose to do that.
Okay, thank you. Any other questions or comments while we have our folks from the Cabinet for Health and Family Services here with us? And thank you all again for attending today and participating. All right, we welcome you to stay with us, but we understand if you have other obligations. We're going to move now to an update from the Office of Career and Technical Education regarding the Career and Technical Education guidance. And we have Associate Commissioner David Horstman. David?
Thank you, Commissioner. The guidance we will offer today is for students to return to CTE labs and classrooms to complete dual credit courses and industry recognized certifications from the 2019-20 school year, with first priority given to the seniors. Today, Mr. Tom Thompson, Director of Technical Schools and Programs from our office, will share our PowerPoint for you in this discussion. Tom?
Thank you, Associate Commissioner Horstman. Let me share my screen. Now, can you see that?
Yes.
Okay, thank you. Thanks everybody for joining in, and I'll get through our PowerPoint here. So as David said, this is for CTE facilities to be open for the completion of industry certifications and lab-based dual credit. The guidance was originally published or released on June 29th, and then we shared it again on June 30th at the superintendent's webcast. Originally, the superintendent's webcast on May 19th outlined the governor's approved plan for secondary students to return to KCTCS campuses to complete dual credit up to June 30th. And then this guidance picked up where that one didn't leave off. That one continued, but this one was to allow those secondary areas to be open. So this new guidance outlines the governor approval plan for students to return to secondary CTE labs beginning July 1st. To complete that, as previously advised, the graduating seniors class of 2020 should be given first priority for the opportunity to return. And typically, we're looking at, since it's not an accountability thing, this is more to help that student with finishing up the dual credit courses, but also to get that industry certification to help them receive a job or promote within the job that they're currently in or career that they're currently in. The guidance is broken down into 4 areas: general requirements, arrival and dismissal times or dismissal, Transition between classrooms and labs, and then area-specific guidance are broken down into classroom, computer labs, and CTE lab areas, or those shop areas. So the first thing that we're going to ask these CTE centers to do is to seek guidance from the local health department officials when planning reopening, or if they've already created the guidance, to have them review that guidance, or if they have questions throughout that, to reach out to the health department officials to help. So we want them to work closely with their designated Healthy at Work officer or Healthy at School officer to ensure the development of the plan addresses students who test positive for COVID-19. This plan should also be established prior to reopening with input from the local health department, like we said earlier. Prepare the plan to determine which students will have an opportunity to test and complete dual credit. And again, we want to prioritize the seniors that just recently graduated, and those that this opportunity will help them finish that dual credit, and this opportunity will help them secure employment or help them in the employment they're already in. We want to prepare a communication plan to make sure that we reach those students and the parents and guardians of those students. And we want to make sure that we confirm with the students their willingness from the student and the parent perspective to participate in these types of activities. And if they're older than 18 or 18 or older, we want to make sure that they at least give notice to their parents so that they know that they're in these environments. We want to require that the scheduling of students is conducted in compliance with Kentucky's Healthy at Work minimum requirements. Anyone entering the school must complete daily temperature and health checks, maintain a daily record of all students and staff in the building. This is going to help with contact tracing in the event that there is a confirmed case. Prohibit access to water fountains, and we put this one in here because the folks that are coming into the building want to make sure that they know that up front, so that they can be prepared to bring refreshments with them if they need to. The bathrooms must be limited to the number of people that would have allow proper social distancing, and again, in that 6-foot distance. We want to require the proper hand washing and hygiene. Hand sanitizing must be required before students start the activities in the facilities or whenever they're beginning their activities. High-touch surfaces must be cleaned on a recurring basis. All staff and students must wear cloth masks unless they can properly social distance or they're isolated, for example, in a welding booth. If they're completely isolated, then they wouldn't have to. And then anytime they're moving, so when you move, mask, anytime you're moving within the facility. Adherence to the additional requirements of this assessment vendor. So if there is a specific vendor-related thing that whoever's offering the industry certification requires, then that would need to be followed too. To the greatest extent possible, we want to keep the same groups of students together to make sure that supports those contact tracing efforts. And then one of the other areas we talked about was the arrival and dismissal, and we asked that staff and students shall remain in their vehicles away from the entrance of the school until their designated arrival time. Queuing, waiting areas, waiting lines should be avoided unless proper separation can be maintained. Agreements shall be made to allow students time. Arrangements should be made to make sure that they've got plenty of time to get there and get to their designated area before the start time. No more than a maximum number of people per Healthy at Work requirements shall be allowed in each area, and then any areas that you can't, like I said, like a tool room lab or a welding booth is so small that multiple people shouldn't be in those areas, so that if they can avoid those areas or make sure a mask is on if they are in those areas. A transition between classrooms and labs, students will be released in small groups with instructions to maintain social distancing. Preparation will be required to ensure orderly transition. Teachers will set out materials, prints, anything that the assessment would require or the dual credit lab would require. Students moving between labs will make every effort to maintain reasonable distance from each other and the instructor. Students will be asked to inform teachers and assistants should they need to move between those areas. The area-specific guidance that we talked about broken down into the classrooms And on the actual document, it is broken down into those 3 specific areas. And there's a little bit of different nuance between them. But in general, seating should be separated 6 feet with designated seating labeled. For sanitation purposes, students may be asked to provide their own materials, pencils, notebooks, calculators. If they can't, then the school should be ready to supply that sanitized materials for them to complete those assessments. Computer workstations, desks, materials, equipment, tools, seating should be disinfected after each use. And then instruction must be given regarding the use of healthcare PPE used in conjunction with program-specific PPE. And CTE classrooms, they're used to wearing safety glasses and shields and welding helmets. So we want to make sure that we allow or give the correct information when we're talking about how to use regular healthcare PPE in conjunction with those. And then if you've got any questions, follow-up questions, if we don't get them answered today, then you can reach out to our executive advisor, Leslie Slaughter, or myself, and we'll be happy to try to answer anything that we can.
Guiding question here, what do you feel are the biggest barriers to reopening secondary CTE spaces for completion of industry certification and lab-based dual credit coursework? I want to give a shout out and a thank you to KCTCS and the Council on Post-Secondary Education. They were able to open their 16 facilities over the summer before we could get to this point of opening ours, and they readily made available, and this was their own idea, and they initiated that, their facilities to our students to go over there and take advantage of those lab-based experiences that they needed. I won't say it was easier, but it was easier for us, for CTE, to go ahead and open their 16 facilities than it was for us to open our 52 over the summer. And so I really want to thank them for that collaboration. And we also learned a lot from their experience. I think, Tom, you would say as well, in their opening their facilities, and that's assisted us in providing this guidance. Do we know, David or Tom, to what extent our students took advantage of those KCTCS facilities over the summer? Do we have any statistics or data on that?
I have some anecdotal data from Dr. Williams from the systems office. She said that they were moving right along with the students that they had used their own instructors for dual credit for the secondary students. Tom could probably share more of what's been going on in the ATCs. I know we have some traffic in there, but I don't have numbers.
And I don't have any solid numbers on it, but like David said, I know that we are doing that just from having conversations about travel and permission slips and things with our student or with our teachers preparing for it. And we've encouraged them to be a part of that so they can transfer whatever information or gaps there were with our students to the KCTCS folks to help fill those gaps in.
All right, any other questions or comments? Here's a question. Can Mr. Thompson or Mr. Horseman talk to the success of the implementation of the health guidelines?
Well, I would say that I meet bi-weekly or at least monthly with Dr. Williams from KCTCS, and I've not been informed of any health issues or problems through the process with post-secondary, and I haven't heard anything from Tom and his group with us having any issues in the ATCs.
That's good news, and I'm sure this question was seeing if there are issues that can forecast some issues as we open up our other school buildings in the next few weeks and months. Any other questions, comments, feedback? All right, if you think of something during the continuation of this webcast, feel free to put that in the chat. You can also include that in your exit slip as well. Thank you both, David and Tom, for the presentation.
Thank you.
Thank you.
Next up, we have a workplace health and safety guidance. With us today, we have Angie McDonald, our school nurse consultant at KDE, as well as Kay Kennedy with the Office of Finance and Operations. Angie and Kay, turn it over to you. And I will point out the guiding question here: what supports do districts need to implement the safety expectations and best practices for health and safety to reopen schools?
Thank you, Commissioner Brown. This is Kay Kennedy. This document was released last week, and we discussed it on last Monday's Superintendent Advisory Council, and it was presented as well at the Superintendent's webcast on Tuesday. So Angie and I are happy to share with you this information today. Our document, Reopening Schools, Workplace Health and Safety, actually has 5 components to it that we'll be discussing today. We talk about the health and safety team that was brought up in the very first guidance document that we issued from the department. Put a team together to help. This message was to districts. Put a team together to help explore and to drill down into the areas that will need special attention as we contemplate reopening of schools. And we talk about those areas a little bit more in this document. Angie's going to talk about health resources and support within the school and the mitigation strategies that we expect to see in place in schools as children and staff come back in the fall. And I'll wrap up by talking about employee health and wellness as well as student health and wellness as we open the buildings back up and how we can best manage keeping everyone safe in that environment. For our presentation today, we're actually going to look at the document. Can you see the guidance document that we issued, the COVID considerations for reopening schools?
Yes.
Great. So in our document, we include a lot of direct links to information that is provided by our public health partners, either from the federal level through the CDC or through the state level, the Department for Public Health. And we have direct links to those resources embedded in the document. For example, as school districts contemplate returning in the fall, the CDC has created a decision tree that can be evaluated on the local level. It's important to know what's going on in your area as you make that decision, because what's happening in Fulton County, Kentucky may be entirely different than what's going on in Pike County. And to take the various factors into consideration, we've provided a link to this school decision tree as provided by the CDC. So back to our guidance document. The next link you see here is the guidance on safety expectations and best practices for Kentucky schools, which we are referring to as the flagship document prepared for us by the Kentucky Department for Public Health. And it outlines all of the expectations that staff and students should expect to follow when we want to have a safe opening to school. Okay, again, in our document, we'll cover these 5 topics. And I'll move now to the health and safety team. As I mentioned earlier, in our first guidance document, we encourage school districts to form their teams. And as we've gone along and issued additional guidance, there is a lot of information, and the struggle, I think, for some school districts is how do I best organize my team, or how can we keep our eye on the ball? How can we get our arms around all the things we need to do? And again, we've provided a link to a nice tool from the CDC. That contains a checklist. Make this just a little bit bigger. A checklist of considerations. Is your district ready to open school? And this assessment document is divided into policies and procedures, facilities and supplies, education and training. There's a component on communication. Then it evolves into a daily or weekly readiness assessment, several pages into the document. But what I'd like to point out is that districts can adapt this checklist to their own needs. They can identify the person in charge of that particular area and have a way to keep track of how activities are progressing as we move towards the start of school. So this checklist would be very important for districts to either adapt or to utilize as it is, again, available through the CDC. Some additional helpful links from the CDC interim guidance for businesses and employers, which addresses many of the expectations around building cleanliness, how you move traffic through your building. Again, some of the things that were mentioned in the previous presentation about how you can keep your employees, how you keep staff and students safe. We've also included a link to the interim guidance provided by CDC for K-12 schools and child care programs. Several considerations for district planning that we'd like to call special attention to would be additional communications that need to be considered for your school families. Try to be as transparent as possible. Get the information out to people. Survey your families to see what their input will be in terms of what can work for them. We know districts already have a flu plan in place. How can you adapt that plan to help you plan for COVID-19? Don't have to reinvent the wheel. Perhaps most importantly is working with your local health officials to understand the role of the school in the contact tracing process. This is a huge undertaking, and with the number of students and staff involved, the fact that we know which students were on which bus, we know which students were in a particular classroom, we know who ate lunch in their classroom as opposed to eating lunch in the cafeteria. All of these tracker type processes that are available now to schools will be very helpful in the contract tracing process that's carried out once a positive case is identified. Student health requirements such as immunizations, physical, dental, and vision examinations have not changed. It's very important to keep those up so that there are not unintended consequences from other illnesses or other problems that students may have that keep them from being successful. So at this point, I'm going to turn the conversation over to Angie McDonald, who can talk about the health resources and support available in schools. Angie?
Thank you, Kay. Just wanted to take a moment to get my headset adjusted so maybe I won't have such feedback. To talk a little bit about the health portion, resources and support. This is geared more toward your school nurses and district health coordinators. I tried to, as a former school nurse and district health coordinator, after we finished finalizing the Healthy at School document, I put on my school nurse hat and thought, okay, here's the big game plan. What resources do I need to make this happen? So this document breaks down lots of resources from relevant national groups such as the National Association of School Nurses, the National Association of State School Nurse Consultants, the CDC, and whatnot. There are lots of links here. I'm not going to go into them one by one, but I will kind of give you a high level review of some of the material that is in here. I did list a thing of list additional duties that just the COVID-19 response will be put on your school nurses or school nurse, as the case may be. And it's going to be quite a heavy task. It's you know, I'm not going to lie, it's going to be rough. There's a lot of students that will need a little extra TLC because of fear, or they may have family members at home that they're worried about bringing things to, or they may be worried about getting sick themselves. So it's very important that the school nurse works closely with your guidance counselor. Be extra aware of any possible mental health concerns that you may notice from staff and students, and make those referrals as possible. One thing too is to help develop some protocols for teachers and staff to know when should you send a student to the nurse versus is this something simple or minor that possibly a Band-Aid or whatnot could take care of the situation in the classroom and not have to needlessly expose a student to other symptoms while they've gone to the nurse's office. The school health room is going to be more important than ever this year. Most school nurses' offices are very small, don't usually have a lot of ventilation, and we're not asking you to build a new school nurse's office, but we are asking you to possibly even reconsider relocating the office for next year if possible, to try to give more square footage. They need access to running water. They need a sink at a bare minimum, and ideally a private bathroom and a window that you could open or crack to get some extra ventilation. Every school should have a separate isolation area for students and staff to wait if they are exhibiting symptoms and need to be picked up. Of course, those students should have a mask on while they're in that area, be spread out as much as possible. And of course, there should be thorough cleaning anytime students leave, just like in the nurse's office as well, in addition to the daily cleaning that should be going on. And we've accessed or mentioned the facilities and logistics guidance that talks about cleaning. That's mentioned in this area as well. Mitigation strategies, we talk about all the different types of PPE, which we've all kind of become very familiar with. I've added some links from the CDC on the strategies to optimize your supply, documentation from the National School Nurse Association on recommending the best face masks for health professionals or in schools. There's also some links to posters and videos on using PPE correctly, how to put it on, how to put it off, take it off, how to use gloves correctly, and whatnot. We go on to talk about masks. Of course, we recommend all students first grade and up should wear a cloth mask unless they have a medical exemption. It not only protects the individuals in the group, but we know that it protects us as well by wearing a mask. And this is very essential, as we talked earlier. If you're moving, you need to mask. But if you can be seated 6 feet apart and no one's moving in the classroom, it is acceptable to take the mask off while you're doing independent work or while eating in the cafeteria. We go on down to more helpful links on hand hygiene, social distancing. There's posters that the school nurses can print and laminate and hang in their schools. Lots of free resources that for them right there to use at all those links. We go on and talk about temperature screening. Of course, we know that a fever is considered a temperature greater than 100.4 degrees. And if there are other mitigating circumstances or a high level of cases, your local health department may make other recommendations about the fever. They could possibly recommend sending home at a lower degrees if needed. We recommend using non-touch thermometers when at all possible. Because using the oral thermometers, not only is it more time consuming, it's more expensive to use the little covers, but it also can spread respiratory droplets in the air. So if you do not have access to the infrared thermometers, a forehead thermometer would be the next best option. And let's see. We also recommend, of course, screening all temperatures when students arrive at the building. If not completed on the bus, we want, if they're a car rider, they need to be screened right as they're getting to the car before the parents pull off. That way, if they are febrile, they can be sent with parent and, advised to seek medical treatment. For our students who may walk and come in and a different entrance, there of course needs to be someone there as well as the buses. So this is going to take an additional plan per se on how you're going to screen those students, who's going to cover those students, and what to do if a student does have a fever. What's your plan? They need to go straight to the isolation area? Do you need to radio the nurse and they will advise you where they want you to send that student? But you do need to have an individual plan for your school as to what to do if someone reports with symptoms. And I'm going to turn this back over to Kay.
Okay, thanks, Angie. The last two sections deal with the employee wellness and the student health and wellness. And the main point here is to try to develop a culture and encourage a culture of stay home if you're ill. We know that teachers are troopers and staff members are troopers. The cafeteria ladies are troopers. But in this particular case, it is best to stay home if you are ill rather than come to school and fight through that illness and perhaps spread it unnecessarily. There is an example at the back of the guidance of a quick health self-assessment document, and it contains a list of symptoms that you want to screen for. The example in the back is of the form that we use here in state government. It could be adapted to your district, or you could certainly develop your own. You should have a process in place. What happens if an employee does present with symptoms, and develop that protocol that will be necessary if an employee has been exposed to a person with COVID-19 or employees who have tested positive for COVID-19. So in that protocol, several factors you need to address, particularly what are the required quarantine or isolation rules, procedures, and we've provided links to the CDC guidance on those as well. So if you have an employee with symptoms but has tested negative, there's a process to return to work. And if an employee develops symptoms during the workday, how should that be handled? It's important to work through your protocol, and then clearly communicate that to your staff. Clearly communicate it to your families so that they can rest assured that there is a process in place that is designed to keep their students and the staff as safe as possible. Again, a couple of helpful links, how the school nurse can help in this process, and the CDC has provided some special guidance for school nutrition professionals and those volunteers who may be assisting that part as well. With respect to student health and wellness, there is a health assessment at school component of this. We propose that parents be allowed to do a quick health assessment, including a temperature check, before sending their child to school. And for students who ride the bus, a verification of this health assessment is required to ride the bus without having a temperature screening. So we've given an example of that assessment form in the guidance document, and you can again adapt that as you see fit. It's very important that the district develop and communicate to families how daily entry into the building will be achieved. You know, there's car rider lines, there's bus drop off, there's walkers, and how you are able to manage those convergences upon the property and get folks to where they need to be with proper social distancing, get the temperature screening taken care of, is a logistic exercise that you can plan out, but you need to communicate it to folks so that they know how to react when you have that first day of school. Should a student present with a symptom, a process must be developed so that the child can be picked up by the parent or caregiver, and we encourage with the parents of those systems that the child seek advice from their health care professional about additional testing for COVID-19. Students could be exposed to a person who is infectious with COVID-19 or to other students who may be exposed to COVID-19. So developing a protocol to address that, including these components, would be important to have documented and clearly communicated so that folks know how this is going to be handled. Again, we include links to other helpful information. Other resources within the CDC provide communication resources, posters, videos, etc., that you can use to post in your buildings for the hand hygiene, for mask wearing, for all those behaviors that we expect students to follow, students and staff to follow. Good communication resources are available that you don't have to pay for. OSHA has also provided guidance on preparing workplaces with respect to COVID-19, so that's a great resource as well. To finish up, I'd like to point out just the couple of items in the appendix. The parental assurance for the daily student health assessment can be on file in the office and allow the student to ride the bus, understanding that they'll have perhaps a further temperature screening as they enter the building. And then here's our sample employee health self-assessment form. At the state, we do this by pay period, so monitoring these symptoms as a checkoff helps with subsequent contact tracing should that be necessary. Okay. So Kevin, I think at this time we are ready to take questions.
All right, thank you. This is Karen. Kevin has dropped off. Oh, sorry. Did I step on somebody? All right, we do have a question from Representative Bojanowski. You want to go ahead?
Okay, so I'm not exactly sure if this question is for the panel who just presented or just in general. Following up, I did ask a question during the Education Committee meeting last week and got some follow-up, and it's regarding if teachers or educators end up having to quarantine, how will will they get paid and how will that work? So we did have a clarification that Emergency Paid Leave Act of 2020 will offer 14 days with full pay if teachers or educators are directed to quarantine, and 2/3 of pay if they're caring for someone who's sick with COVID or quarantine. In light of the fact that there may be a lot of situations where teachers might have to go into quarantine multiple times, do you have any idea of how that will be handled regarding educator pay?
Okay, can you answer that one?
Karen, this is Robin Kinney. I'll try to provide some additional information. Representative Bojanowski, we have heard from superintendents and also from teachers and others in the school districts about emergency days and the desire for additional flexibility on emergency days. I think if Commissioner Brown was still on the call with us, he would share with you that we are working right now to effectuate the ability for districts to do that, similar to what they could do in Senate Bill 177. So we're trying to do that in the next week or so to put in place the flexibility of districts to make those local decisions to grant additional emergency leave if they'd like to do that. So that hasn't happened yet, but it's in the works.
Oh, I'm so excited to hear that. I know that's a concern for educators, both for being exposed to kids in their classrooms and then maybe having situations with their families at home. Thank you. I greatly appreciate it.
You're more than welcome.
And then we have Julian who has a question for Kay.
I do. Thank you. Ms. Kennedy?
Mr. Tackett?
Wonderful as you, I hope, are as well. Quick question for you. And this just happened to come up today in a situation that we've had occur in some of the early summer stuff. I didn't see anywhere in the guidance that you just shared, and I might have missed it, around page 9, where we talked about return with COVID. Question that was posed today, we have a COVID positive student who goes away, does quarantine, does everything, now has 2 consecutive tests validating that he or she is no longer COVID positive. Do you have guidance or planned guidance on what signatories should be required for that return to school? We got a little feud going between a parent who has a verification from the health department twice and a school that wants to require a doctor note, an MD, like they do with a concussion. So I'm just curious if you all have thought about the signatory requirement, or is that totally going to be left on the local schools? That'll obviously drive part of our guidance later on.
So, Commissioner Tackett, I think what we've tried to stipulate in our guidance is that the local folks can develop their protocol on the return to school, and I would do that. I would recommend, obviously, that they do that in conjunction with the local health department, and whether or not to require a medical provider release to return to school, seems like a logical thing. You would assume a person that's perhaps been COVID positive has been under health care of some sort. But again, whether or not a signature of a healthcare provider is actually required, or just evidence of the test and the expiration of any quarantine type requirement, would be at the local level. I don't know if Dr. White is on the line now.
I'm here now. I'm on the phone. I can't get my home internet to get into Microsoft Teams. It'll get into Zoom, but not Microsoft Teams today, so I apologize. I think we put in our flagship guidance, Commissioner, that you would either need clearance by your healthcare provider or the health department. So if I have COVID-19, I have a positive test for COVID-19, I'm put into my quarantine, and the local health department releases me from that because my body has fulfilled all the requirements for ending my isolation, then I think it's safe for that child to go back, or that adult even, to go back into a school setting. I would be worried. There's nothing wrong with going back and getting a doctor's note, but I worry about parents having to take time off from work, having to pay copay, or having to endure an expense just to say, yes, you can go back to school, when someone had a resolution of their symptoms through the end of an isolation period. And there's a list of things. You have to have no fever for 72 hours and no symptoms for 10 days. And so the local health department can verify that. And for me, that seems to be sufficient.
Thank you all very much.
All right, we have a question from Donna House. She says, I predict that schools are going to have problems when students do not have COVID, but will have a temperature due to chickenpox, simple colds, or flu. Are you going to mandate that schools make students have a 10-day quarantine even for these illnesses?
So this is Dr.
Well,
Messerly.
if they
I can
have
take
any of those illnesses, there's a quarantine period they would want to be in anyway, just to prevent them from coming back to school and spreading all those other diseases that you talked about. So I think we had talked at our last call, and Angie, correct me if I'm wrong on this, that you have a fever, you get sent home, you have no more symptoms, you go 3 days afebrile with no other symptoms of anything, then you're allowed to come back to school. Did I depict that correctly from the CDC guidance?
Yes.
Okay.
Yes.
So if in those 3 days you break out with chickenpox or the measles, or you get sicker and get a flu diagnosis or whatever, then whatever the diagnosis is, you would follow that usual period of school absence. But the COVID-19 would follow the COVID-19 isolation period. And then if you never have another fever again, you never have another symptom of anything again, and you go 72 hours completely afebrile with no other symptoms, you're allowed to come back to school. Does that answer that question?
I believe it does. And we're going to go, I don't see any more questions in the chat, so we're going to go ahead, since we have Dr. White and Dr. Messerly here with us now, we'll go ahead and move in. Oops, sorry, I accidentally muted myself. We'll go ahead and move into the last item, which is updates from the Department for Public Health, and any Q&A that you have for Dr. White or Dr. Messerly. And of course, anything you have for any of our other guest speakers, they're still here as well. So the floor is open.
Karen, there is one more question on the previous topic from Kay.
From Kay?
4K. Is there any
okay.
guideline that prevents teachers from wearing shields rather than masks?
Thanks, Melody.
So again, this is something that the folks from the Department of Health are happy to weigh in, happy for them to weigh in as well. But in simplest terms, the guidance is that teachers, staff people, the face mask is the most effective at keeping your germs to yourself, keeping your stuff to yourself. The face shield is good to protect you from incoming. Now, if you are in a situation where you can't wear a face mask, you have an exemption for a medical reason or sensory or whatever those other things are, the face mask is better than nothing, but it does not prevent you from spreading if you're shedding the virus at that time. So that's the non-medical person speaking. I'll turn it over to Dr. White and Dr. Messerly.
I think you covered that very well. If you've ever worn a face shield, and the point of you wearing protection is to prevent your respiratory particles from spreading. And if you've ever worn a face shield, you know that there's all kinds of space around that face shield for those droplets to get out and to be spread. So you might not, as Kay said, take a direct hit, but you are still going to have a tremendous amount of respiratory droplets shedding to the people around you in a very different way than if you have a cloth face mask on. And we've mentioned medical exemption, but I certainly don't want it to sound like that there are a lot of people that really will qualify for a medical exemption. There will be a whole lot of people that don't want to wear one. There are going to be people with mild cases of asthma that are not going to wear one because it's uncomfortable at first and it's a little bit scary. But I think what you do is you start, and I got an email from a pediatrician that I know saying, we're going to have all kinds of people wanting medical exemptions when they really don't need them. They just need to start practicing where the child or the adult wear it for an hour a day, wear it for 2 hours a day, and gradually get used to it. There are very, very few people that would truly have difficulty breathing from wearing a mask. There are tons and tons of people that work in operating rooms that wear those things for 8 hours a day. I can't think of anybody that I've ever seen that couldn't wear one in an operating room.
And
Thank you.
This is
Go
Dr.
ahead.
Meserly. I work in a pediatric clinic, and I have 3 older children of my own. But I think it's wonderful that Governor Beshear has put out this mask mandate for 30 days, because I think it's a wonderful time for families and children to get used to wearing that mask the rest of the summer, before school opens up, just to have those children get used to having it be part of their day.
All right, we've got another question from Donna House. Primary teachers are concerned about their teaching abilities with students unable to see their mouths. I get this question daily from my members. How can we help primary teachers, and what do you recommend?
Well, I think, and I did a talk earlier this morning with the post-secondary education crowd, and the thing that I tried to explain the way that I see it is nothing we do for the next year is going to be like we did it in the past. Everything's going to be different. Homecoming's going to be different. How we teach is going to be different. How we parent is different. How we grandparent is different. So they are absolutely correct that this will be very different. Will it be impossible or unable to be done? No. And it will just be something that, again, we will gradually learn to see as I won't say it a new normal, but a new way of living our lives until this pandemic is over. So yes, it is going to be a challenge. And yes, it will be difficult for some students more than others and for some teachers more than others. But the alternative is not wearing protection and spreading a deadly virus. So that's not a good answer, but that's the only answer that I've got. Can you articulate that any better, Dr. Meserly?
No, that's absolutely right. If just like going to the grocery, you're wearing a mask, unfortunately, in the classroom, the best thing to protect the teacher, and the teachers do have to realize that in the school setting, who we are looking at protecting really more than the students is the adults in the building. The adults in the building do have poorer outcomes from COVID, so those teachers and staff do need to realize that them wearing a mask is very important, because adults do tend to have poorer outcomes from COVID-19.
Karen, this is Kay. I do see that Representative Bojanowski mentioned the face masks that have a clear insert, and I venture to say that good old American ingenuity will probably come up with some other alternative that might present a clear picture of a person's mouth. And as far as I know, I'm not aware of any reason why a person couldn't wear a mask with an acrylic insert, as long as the nose and the chin are covered. The face cloth, the mask has to go above the nose and under the chin if there's a clear acrylic insert. And I just feel like we're going to see other options that are developed as we move along in this process that address some of the special situations.
I agree. I think the masks with the shields are going to turn out to be very helpful. I haven't seen any studies or research on them, but intuitively they just make a lot of sense.
Okay. I'm not seeing any other questions in the chat. Feel free to unmute yourself as well. Oh, I've got one from Commissioner Tackett. Question for Dr. White. State regulation has State regulation has adopted a heat index program where if the heat index gets to a certain level, in some sports with lots of equipment, the heat index threshold lowers if the user has on gear that raises internal temperature. Is there evidence that the wearing of a mask raises body temperature such that if masks are worn, the heat index threshold should be lower for activity alterations? And explain.
I have absolutely no information about that. Maybe Commissioner Tackett, who deals with the athletes, might have more, but I can't answer that, and we can certainly look for more information on that. I apologize. That's a big void in my head.
All right, we're open for any other questions. I feel like I'm on talk radio. All right, I can always count on Donna here. She says that's great about acrylic masks. You have to understand that teaching in primary grades is a lot of modeling. Coming from a special ed teacher, hearing impaired students are going to be at a major disadvantage. Maybe you should put it out to districts to offer acrylic masks.
You know, Donna or Kay, I thought we had that in the flagship document about acrylic inserts for the hard of hearing student. I know it was in some draft of it. We probably ought to go back and look and see if that's in there.
And Mary Pat added they're using them in other counties is what I saw on the news this morning.
Mm-hmm. Yeah, that's why I haven't really addressed that, because I thought we already had that in there, but I will go back and look and be sure that it didn't get taken out of one of our drafts, and be sure that we have that in our final product if we have to go to flagship 2.1.2 or something like that.
Nancy also says this is the guidance schools know. From Eric Kennedy, I know some districts are producing procuring a strategic number of those masks. His is, and yes, he says it is in the guidance.
Oh, good.
Greta Hilton, she says options for clear masks is in the guidance coming out next week from her office as well. So we'll have even more guidance on that. Thanks, Greta.
This is Angie. I just had a health coordinator text me a question for Dr. White and Dr. Meserly. Do you know, are there any guidelines going to be coming out on foreign exchange students coming into the country?
In what?
Foreign exchange students that are going to be coming in.
As far as, are you asking if they're going to be coming in, or is there something we should put in our Healthy at Schools document?
They're asking for guidance about what to recommend for foreign exchange students coming in.
I think that would all be, most of that would be controlled by the U.S. State Department, you know, if someone is coming. So if someone is arriving into the U.S. from a foreign country, there will be specific guidelines on how that individual quarantines, whether it's an exchange student or just a traveler. So I think that's really higher up or higher above than us at the state level.
They were asking if we were going to have anything at the state level in regards to that. So
not that I know of.
Yeah, I think we would just channel whatever the State Department would say. But quite frankly, the U.S. and Brazil and India are the highest places to get something. So there's probably
nobody's going to be coming here
about us going there than them coming here. But I'm sure the State Department will have a set of criteria that we would, of course, follow.
All right, thank you.
All right, any other questions?
If you don't care, Karen, this is Julian. One other thing, just to fill in, because we've already gotten involved a little bit on the exchange student issue. There was an executive order issued in the last couple of weeks about exchange students being able to stay if school goes remote or distance learning. From a sports perspective, we're already knee-deep trying to get clarification. Be glad to get that to you and Kevin if we get an answer. I think more than anything in terms of restricting, it's more about maybe having to go home in the middle of an exchange for either F or J1s. Remember, the Fs are controlled by Homeland Security and the Js are controlled by the Department of State. So you got two different government entities. But as soon as we get anything, I'll make sure Kevin gets it, and maybe that'll keep everybody informed.
Right.
Thank you for that. Any other questions?
And this is Dr. White. Would you send me that question on the heat index level to be sure that when I do look that up, I am addressing their particular question appropriately?
Yes, ma'am. I'm typing that email as we speak. And
Thank you.
And it's on our agenda for the Sports Medicine Committee meeting that's meeting this week. So maybe we'll all be together on it like we have been.
Sure. Thank you.
All right. Well, if that's all the questions, Melody posted the exit slip for us. So if there's anything that comes to mind that you want to add, please put it in there. And there's a couple extra questions in there for anything that you may want to see in the future. So please do take a moment and fill that out for us. Just a reminder that our next meeting is in 2 weeks on July 27th. Donna says she's going to miss Kevin when the new commissioner comes. We all will. All right.
Karen,
well,
we got involved in the questions on that topic with on Kay's topic from the guidance document that involved the public health officials, but we do have an agenda item for updates from the Department for Public Health if there was anything else they needed to share.
Yeah, that's what we were doing.
Okay.
All right. Well, if there's nothing else, then we will go ahead and adjourn. Thank you all very much for participating.
Thank you.